you're floating.
Let's not get too
Just getting
excited.
mad.
Go ahead.
Okay,
I'll
sit
sit
down.
then.
I can do one with this, and then I can use another one. This is not very difficult, so the previous one was vertical mattress. Why did we call it vertical mattress? Because if you were to look at this wound and take a cross-section of this wound, as you can see in this is a cross-section of that wound. Why was it called vertical mattress? Because the first bite was deep, if you notice here. I'm just telling you the difference, why it is. Then it went deep and came out far. So far, yes? And the next one, he has shown it very far away. It should have been closer here, dermoepidermal junction, and we tied it off here. So this and this are in the same vertical plane. Did you understand? That was why reason we called it the vertical mattress. And some of you it went a little this way, that way, but you'll get used to the technique. It should. That's why it was called vertical mattress. Now what we're going to do is the next one. Can you flip the next one, please? No, no, go back previous. The horizontal mattress. There's the horizontal mattress.
This is
Go down.
and this is after.
Come a little after this. Horizontal mattress. The horizontal mattress, we will go in this axis. That's why it is called horizontal mattress. And you'll find that it is not very difficult. This is used in places where the skin has got a subcutaneous muscle, like for example the neck. It's got platysma, or the scrotal skin, which has got the dartos. What here we want is, we want hemostasis as well as eversion of the edge. And that's how you'll notice when we do it, the edges will get everted, because the underlying muscle in the subcutaneous tissue of the skin tends to invert the skin. And inversion is not good for healing. So we want eversion. So you will see that. So the first one, as usual, Okay. This is too small. I should have taken a bigger one. You need a sufficient length for this. Yes, you've got a delicate surgeon's hand.
You don't.
I've got a clumsy hand. That's why they say plastic surgery, cosmetic surgery, females are good at it, because they've got very delicate fingers. Okay, so the first one, as usual, when you're taking a bite, just a few smaller, finer points. See, it's a curved needle, right? So try to follow the curve of the needle with your bites also. So that's what we are trying to do basically. Take a one and pick up the other side. See the tip, push it out. Okay, as usual. Catch hold of it. Don't pull it straight like that, but try to pull it out like that. That's the usual technique for all suturings. Okay. Now watch. We didn't do anything. We have not tied any knots, nothing. The previous one, what we did was we took a closed dermoepidermal junction in the same level. Now we are going to go a little opposite. I'm going to again reverse my needle direction. On the same side, I come to this and I take a bite here. Full thickness as usual. And on the opposite side again, full thickness till the tip comes out. Now watch how the suture will look like. You see, came like this, just to make sure I'm not wasting too much material. Tie it off. Can you see? This way, this way, this way, this way. And you can see the edges got everted. This is used for scrotal skin where there's a dartos, and for necks where there is platysma. And then tie it off as usual a few times, a few throws. I'll do one more.
You wrapped around the scissor once for some of them. Is that okay? You wrapped around the scissor once for the one to the last knot. Is Is that
I
okay?
don't get you. What did I do?
Tying the knot, you wrapped
Yeah,
it once.
you wrapped it around the
Yeah,
sleeve.
just for speed of this thing
Oh.
here. Sometimes when you're alone, you don't have anybody assisting you. Picking up the thread scissor again and again is very difficult. So you can hold it like this. This is a technique you can do. You can, so you can just flip it and you can cut again, hold it back. Flip, cut, hold it back. Because it's the last one, so I thought I'll show you a few other techniques, which all of you will master anyway, sooner or later, if you are interested. Okay, one more. So again, the usual way. Usual way. Okay. Now, same side, full thickness, full thickness. Okay, this is what you wanted, isn't it? Tooth loops. I did it for you. Tied it up. So you can see the edges are getting inverted. This also secures hemostasis, because I told you these are used for places where there's an underlying muscle. The platysma, the arteries, they tend to bleed a hell of a lot. So when you're doing this, it secures hemostasis as well as inverts the edge. And then I do this. It's not very difficult. So you can do this one. This is the horizontal mattress.
Did you get me a watch for that? Did you get me a watch?